Hello everyone, welcome to RAAONLINE. I'm Dr. Abhinaya. I'm a consultant pediatrician. So in Nelson-based pediatric teaching, in the chapter discussion of respiratory system, the topic that I'm going to discuss now is on congenital anomalies of larynx, trachea and bronchi. So let's get started. So first, just a brief introduction about larynx. So larynx, we all know it functions as a breathing passage and it is the primary organ of communication. So any anomaly in the larynx will cause some common symptoms. Okay. So these common symptoms can be related to the communication thing, that is, it can alter the voice, it can be a cause of respiratory distress, and it can cause difficulties in feeding. So airway obstruction could be there, noisy breathing could be there, feeding difficulties could be there, and abnormalities of phonation. So many a times when we see laryngeal disorders, most of the symptoms that I have mentioned just previously would overlap, but a careful observation of the child, examination with regards to the age group and the overall examination, we will be able to find out a probable cause. So first let me start with laryngomalacia because it is the most common congenital anomaly pertaining to the larynx. So laryngomalacia, the incidence is very common, around 1 in 2000 to 1 in 3000 infants. There is a slight predominance of boys when compared to girls, and the black population and the Hispanics are at the highest risk for laryngomalacia. So what exactly happens in a laryngomalacia and when do they present? Most often these congenital lesions like laryngomalacia do not present at birth, but they take maybe a 1 week or at the 2 weeks mark. At and around the 2 weeks mark, the parents could appreciate the noisy breathing from the baby. And this noisy breathing, which starts at probably around 2 weeks, it keeps increasing in severity up to 6 months and has a plateau, and then there is a resolution period. So this is what generally happens. Even though most of the times we encounter cases of mild laryngomalacia, parents are really worried because of the noisy breathing which keeps increasing in severity. Gradually it decreases with time, most of the instances. So why laryngomalacia happens? What is the etiology behind laryngomalacia? Actually, there are so many studies, so many theories have been proposed, so we cannot pinpoint to one particular etiology. So generally we have heard of this, that is the soft immature cartilages of the infant larynx that collapse whenever the baby takes a breath. Whenever there is an inspiration, the soft cartilaginous structures will collapse. So that's when we hear the inspiratory stridor. So this is one of the most common theories that has been proposed and accepted. So now not just the immaturity of the cartilages, but there is some neurological dysfunction behind this. So neurological dysfunction in the sense the laryngeal tone. So the tone of the laryngeal muscles is altered, probably because of the abnormal integration or abnormal innervation of the larynx. Okay, this is one another theory. Next, the supraglottic nerve diameter is increased. This happens in cases with severe laryngomalacia, and there is a causative or an associative factor with laryngomalacia, but now it has been accepted that gastroesophageal reflex, that is GER, is associated with laryngomalacia, but it does not act as a causative factor for laryngomalacia. So what happens whenever there is a reflex, whenever there is a gastroesophageal reflex, the micro aspiration or the reflex will cause irritation to the upper airway, irritation to the larynx. So this irritation will cause edema, and that increases the already existing stridor or the already existing noisy breathing. Okay. So the three theories that you have to know is: one, it is the immaturity of the soft cartilages. Those cartilages will collapse on inspiration. One. Second, abnormal innervation of the larynx. Third, per se the supraglottic nerves, they have an increased diameter, and GER has a associative factor with laryngomalacia. So these are the etiological theories that have been proposed for laryngomalacia. So what happens in the pathology. So, because of the inherent weakness of the cartilages during inspiration, normally the larynx structures are very rigid, right? But what happens when the structures are very soft and immature? There will be an obstruction because they collapse inward, they fall into the airway, they cause that noisy breathing, and when it is very severe, they collapse and they close the airway completely. This obstruction or this collapse happens only during inspiration. So what obstruction is this? This is called as a dynamic obstruction. It is not a fixed obstruction, it is a dynamic obstruction. So because of this dynamic obstruction, it results in the inspiratory stridor. Whenever there is a fixed obstruction, it results in biphasic stridor. Okay. So because of the dynamic obstruction, what results is the inspiratory stridor. Around the laryngeal cartilages, the epiglottis, the aryepiglottic folds, the surrounding tissues are all very soft, and they all have this redundancy. So this redundancy is actually surgically corrected in the supraglottoplasty. I will explain in the surgical procedure for laryngomalacia. So just remember all these structures. These laryngeal cartilages are very soft, they are very redundant, they are going to collapse on inspiration, causing a dynamic obstruction that results in an inspiratory stridor. Okay.